Jaundice is another thing to be aware of. It's the yellowing of the skin and the whites of the eyes. It is very common, most often no clinical importance, and usually develops between days 2 and 7 after birth. Jaundice is caused by a normal buildup of bilirubin in the blood as the baby transitions from fetal blood cells to adult type cells. A way this can help is to put the baby in sunlight, if that's possible. But make sure to keep the sun out of the baby's eyes. Excess bilirubin is excreted in stool. Nursing stimulates pooping. If jaundice develops in under 24 hours, it is of concern, and you should call the midwife immediately. Weight. It is normal for a newborn to lose more than 10% of their body weight in the week following birth. By 2 weeks, they should be back to their birth weight or more. Much of this weight loss is caused by losing water through their skin and can be prevented by applying a light coating of oil such as olive or coconut once a day. Only use safe food oils. Otherwise, nursing and more nursing is what baby needs. Special considerations for large or small babies. Large babies, 8 pounds and 8 ounces or more, are at increased risk of hypoglycemia in the newborn period and should be watched closely for problems with their feeding habits, respirations, temperature fluctuations, lethargy, and potential seizure activity. Small babies also need to feed more and more often and have a lowered ability to control their body temperature. So same criteria applies to babies under 7 pounds. Follow-up infant care. You should interview or tell your baby's healthcare provider as soon as possible during pregnancy that you wish to have him or her care for the baby after birth. We like to have the pediatrician needs to already be in place prior to birth. My preceptor is very, very adamant about this because you need to have the ducks in line for the baby once the baby is here. And she would want more specialized care ready for the baby should something happen. Let's see. So, yes, we recommend that you interview carefully to identify the care provider that's best for your family. Let's see here. The birth certificate. As for the birth certificate, please fill out the birth certificate form prior to delivery. We usually have a time frame where the mom and dad do this. If they don't know the name yet, that's fine. We can leave that part blank. The midwife can submit a form to the state and request the Social Security number if wanted. The birth certificate can be ordered directly from the state the day after submission in Washington, or 2 weeks after the birth in Oregon. So since I'm in Washington, we go with the Washington instructions. Insurance, please make sure to add your baby to your policy immediately. Your midwife can give you a signed affidavit of birth if needed. So for both mom and baby, it is extremely helpful to visit the chiropractor in a few weeks following your birth. Very, very helpful. So now we're going to go over some warning signs to be aware of. For the baby, call the midwife immediately if your baby has any of the following. Temperature that is under 97.7 or over 99.5. Respiratory difficulties, noise, grunting on an exhale, flaring nostrils with each breath, ribs stick out when inhaling, or becomes blue or gray in the torso and head. Very important. Or becomes yellow or orange in the skin or eyes in the first 24 hours. Lethargy or seizures. Is lethargy, can't wake up. This is what lethargy, can't wake up even with stimulation, is very tired, won't eat, or has seizures. Possible signs, eyes rolling upon or upward, not up on, eyes rolling upward or fluttering, stiffening of the body, movements of the tongue, lip smacking or excessive sucking, uncontrolled jerky movements or body twitching staring spells, or periods of unresponsiveness. Or if they develop a high-pitched cry. Baby will not feed. If baby will not feed, call the midwife. These are all going over all the warning signs for the baby. Skin bruising or unusual bleeding, especially any bleeding from a circumcision, as babies are very sensitive to blood loss. Or if you feel they're failing to thrive, call the midwife. As for if mom is having a fever greater than 100.4 degrees Fahrenheit, any sign of localized swelling or tenderness in her breast, especially if accompanied by body aches or fever. These symptoms of the breast are symptoms of breast infection. Tender or sore nipples when nursing. These are signs of poor latch that can be fixed very quickly in order to avoid nursing problems. Let's see here. Any sign of swelling or infection around the vagina, especially if you had a tear, call the midwife. Discomfort or burning when you urinate, have difficulty in urinating or being unable to completely empty the bladder.